Memuna Malik's dreams of owning a salon one day was cut short when she found herself at the wrong place at the wrong time.
I heard someone was knocking the door. And he said, Memuna, please open the door for me. Because he was eating. And I said, but the lady does not know that it was the lady who he has the agreement with. The lady thought it was somebody who is coming to also do braid her head. So when I opened the door, the other lady pushed the door and threw the outside.
Sorry. Last time we spoke to Memuna, she expressed an interest in visiting the hospital.
Now what I need is, if I will get a doctor, my nose. My nose is the important thing because I can't breathe. I have to open my mouth like this before I can. If I close my mouth like this, then I'm dying. I can't breathe, and the left eye is snowing, especially my chest. So I'm scared maybe I can get cancer or something because the breast is something else.
Today, she visits the Reconstructive Plastic Surgery and Burn Center at the Korle Teaching Hospital. Her hope is to find out exactly what is wrong with her and what it would take for her face to function again. Dr. Opokuwari Ampoma, the head of the Reconstructive Plastic Surgery and Burn Center, examines Memuna.
Unfortunately, the thing about chemical burns or burns in general is that no matter the amount of reconstructive surgery that is done, we'll try and restore you as much, but you'll never be 100%. You never get your your original state back. Unfortunately, she's already lost one eye, and we'll have to work with the ophthalmologist to see whether there's any chance of restoring some vision to the eye, because she can still perceive light, but as to whether the corneal transplant is feasible, I think that one will be the call for the ophthalmologist to make. It's best to have to realistic expectations.
Dr. Ampoma explains the impact the acid has had on Memuna.
It's because the tissues around the eye is being pulled down in this scar tissue, so the eye is not kind of open and closing normally, and also the eye aperture is not sitting at the right angle; it's being pulled down a bit. So, but I suspect that if we release the lower face, it will help. It will sit back in a more appropriate position. Then we can make that determine whether we need to do some further surgery. But definitely, we may need to. The slit is a bit narrow, so we'll do some little procedure to kind of open up the eye a little bit more, so that she can also to make sure that she can close it more effectively.
We find out how much it will cost for Memuna to be treated.
So I think the first stage we'll be looking at the nose and the area around the lips, the upper lip and things like that. So I think we need to reconstruct those. Unfortunately, for her, one of the commonest tissues that we use to reconstruct the nose is tissue from the forehead. So that one's a relatively quicker operation. We turn the tissues from the forehead and bring it down to the nose to reconstruct the nose. But her forehead is scarred and it's already gone. So it means we have to look and bring tissue from somewhere else. So the plan for now is to look at bringing tissue from her forearm and basing it on the vessels there, and then disconnecting it and coming to use it to build a nose, and then connecting it to the vessels in the face. So there's something called a microsurgical procedure. And so when we do that and bring in this fresh tissue, it also allows us to get a piece of bone and to be able to put into this tissue so that it gives the nose some support, structural support, so that it doesn't collapse in like what is happening now. It doesn't narrow in. If I were to give a ballpark figure in terms of how much this is going to cost, I think we're looking somewhere in the region of between 40 to 50,000 cedis. Yeah, so that's okay. Well, it includes the cost. This is like if you stay in a general ward. So those are some of the costs we're trying to look at that. So this, so yes, I think if we had something up to this 50,000 to start with, I think it would take us a long way. Would kind of advise as we go. It's a bit difficult to kind of predict all the steps, but I think if we had about 50,000, I think that would go a long way to solve most of the problems, at least.
Being the breadwinner of her family, Memuna has no one to help her fund her operation. Her mother pleads on her behalf.
Citi TV for by omu beye yen TV. Intina yen numu amanta omu beji no. Ba nde na yebe hu doctor no. Omu so ombeji Ghana titiska 500 million. Tigana for me nibi mumbua me mi bay na nini ebeka hosa ha mi sramo mi nibi mi ni echire mi ni eni mo bi eni ho enti gisa Ghana for gisa mo boa me na o matimi kakra bi anso na obenya kakra bi an mo mfa mboa me na o mutimi hwe me bay ma me ti mi sramo Ghana for nyina mi sramo mo mboa me o